Explore Medicare, understanding
Good
original,
evening, everybody.
advantage,
This is
and
Voss
supplement
going
plans this
live,
open enrollment
talking
season.
about Medicare today. A couple things came up this past week in a few of the groups that I'm in. One of them being during open enrollment that we're in, October 15th to December 7th. A lot of people, a lot of providers, and like to put out posts talking about going back to original Medicare, and getting off the Advantage plan. And you know what? That's great. I love providers. I work with a lot of them. I have a lot of respect for that. You did a lot of work to get to where you are, but you're not an insurance agent. So I'm an insurance agent. I have brokers. I have agents that work with us. We spent a lot of time to get to this point. We've put in a lot of hours to understand the plans and how everything works. Just kind of let us do our job and help people out. The thing is original Medicare is great. It's an 80-20. And then you should just be on that. But there's pit holes and there's holes in that. So it doesn't cover everything. If you get a drug plan, you have your drugs covered and you have 80% of your health care covered and 20% isn't. There's a lot of things not covered on original Medicare. And that could be a problem if you just have original Medicare and nothing else. Because now you have 20% copay of all your providers. The providers that want this only plan. So then they're like, well, just get a supplement plan. Supplement plans are great. If you can afford it, get on a supplement plan. Plan G, Plan N, they're fantastic. You should definitely try to get on one if you can. But they're medically underwritten. So you got to look at that. Are you healthy enough to apply for a supplement and get on one? Maybe. I don't know. If your plan's dropping this year, United Healthcare, Aetna, some Humana plans are dropping in Arizona, it gives you a guaranteed issue to go on a supplement plan. So then now you got to factor in, you're on an Advantage. It's an all-inclusive plan. It's part A and B and D, all kind of wrapped into one, and it turns the 20% into minimal co-payments for service, and there's no cost to have the plan on a monthly basis. You pay your Part B premium of $185. It's going to go up to $206 next year. You pay that, and you have your Medicare. On the supplement side, it's medically underwritten by age and health. So depending on your age, it goes up. Every year it goes up 5 to 10%. At 65, it starts about 150-ish for a Plan G. And then to get a prescription drug plan, it's about 15 to 100 these days because of the changes in drugs. So you got to keep that in mind. Can you afford? And so if you're 70, I was helping a guy that was 72 today, and it was almost $200 a month for a Plan G, right? A high deductible Plan G is less because you're paying a $2,800 deductible during the course of the year before the plan kicks in. So you really want to get a G plan to cover everything past the Part B deductible of $257. I think it's going up to $288 next year. So you can get the supplement plan, and that's a a la carte. It's an a la carte. So you get the supplement plan that covers the 20%. You pay monthly for it. If you can afford $200 a month, plus a D plan of probably about $20 to $30 a month. So say $230 a month. If you can afford that, by all means, get it. Next year, it's going to go up about 5 to 10%. The following year, it's going to go up about 5 to 10%. So just keep that in mind. So you either pay for it monthly to have coverage, or you get a plan and pay for it as you go. The Advantage plans are pay as you go, as you use it. Now, some of the PPO plans are going away, so that's tough. HMOs are there, but they're still big networks. And then the other thing is people say the HMOs have no network, and people get denied all the time, and they don't get access to everything. It's not that they're not getting denied. They're getting denied because the case manager or whoever is filing for a skilled nursing that's out of network. Of course you're going to get denied. It's out of network. They're not going to pay for that. But if you call the number on the back of your card, the customer service number, and say, hey, what skilled nursings are in our network? They're going to pull up 20 to 30 skilled nursings in the network. Just not the one the doctor prescribed, because that's one they want you to go to, because that's the one they have a relationship with, because that's the one, because that's the one, because that's the one. So, and then they're going to say that this is a garbage plan, you should go on straight Medicare. No, because you're going to drop your plan and get hit with that 20%. Just find a provider in your network. United Healthcare's network in Arizona is gigantic for the HMO side. People say the networks are small and you have to stay within your network. What are we talking about? Even the small networks, there's a new company out, Verta Health. They have all of Banner in their network. Is that a small network? No, not that I know of. So when they say HMOs have small networks, what does that consist of? Only 20,000 providers? I don't know, 10,000? It's a small network. If you look at the provider list, it's hundreds of pages for pretty much every plan. So unless you're in a rural area, if you're in a rural area, then yeah, the provider networks are smaller because it's more spread out, and a supplement plan is good for that. And sometimes you just need a supplement plan, and sometimes that's all that's available, and that's fine. If that's all that's available, it is what it is. If you're in a big populated area, then, an Advantage plan covers everything. Don't let anybody tell you that it's garbage because it's an Advantage plan. They don't know. They might not know. They might have dealt with one incident saying that this isn't going to work. My provider said this isn't going to work, and my mom didn't get the care she needed. Well, did you call the customer service number on the back? Did you call your broker and say, hey, I need some help with this? You have a broker, right? You worked with somebody. If not, give us a call. We'll be more than happy to find a provider in your network. So, I don't know, rambling a little bit. That one catches me every year during open enrollment when I see those posts going out talking about, stay away from Advantage and disadvantage plans. No, not really, because when we're sitting down with people, we're looking at your doctors, your drugs, your vision, dental, hearing, what's going on in your life, your income, where do you live, your lifestyle. We're looking at all these things and trying to find plans that fit to you, not a one-size-fits-all and hammering it in. So, maybe you need some health care and it's time to look into that. Maybe you don't. But there's in Arizona, there's hundreds of plans, hundreds of Advantage plans in Maricopa County that we can pick from. So what's wrong? Let us know what's wrong, and we'll find one that specifically fits your needs. Boom, done. Then you don't have to worry about it. And then we'll find providers in your network that you need to see. Boom, done. What else? What's the next one? Nothing. All right. Well, I can't see comments because I'm still not sure how this all works. Let me see if I can. Nope. Not seeing anything yet. That's okay. We are going live though. All right. Well, you guys have a great evening. I'm going to wrap this up here and say it's open enrollment. Feel out all your options first. You have until December 7th to make a decision, and you can make a couple of choices, feel it out, see all the plans, sit down with a broker, be more than happy to help you out, find something that works best for you. Everybody's different. Remember that. Everyone is different. And that's about it. So hope you have a good evening. One last thing on the everything's different. I know I'm going a little long on that one. We'll just let it go at that. We'll circle back next week on the end of that one. All right, you guys have a great evening. It's been about 10 minutes. We'll talk to you soon. If you have any questions, put them in the comments. I'll be more than happy to help out and answer as many as I can. Thank you.